From MTN News, this is Montana This Morning.
Good Friday morning. It's 5 o'clock. Welcome to Montana This Morning. I'm Victoria Hill. Thank you so much for starting your day with us. We begin this Friday with some progress on the pandemic. The coronavirus vaccine is closer than ever to rolling out across the country. A panel of independent scientists concluded the Pfizer-BioNTech vaccine is safe and effective. But as CBS's Bafta Yamam tells us, it comes as the nation is facing a record number of daily deaths.
Comprehensive and independent review of the data.
A government advisory panel voted to recommend widespread use of the coronavirus vaccine from Pfizer and BioNTech yesterday.
So we do have a favorable vote.
The Food and Drug Administration is now expected to follow suit.
We could see FDA authorization of the first vaccine in the United States within days.
Health and Human Services Secretary Alex Azar says doses will start shipping within 24 hours of the FDA's emergency use authorization.
I'm on call for when it gets delivered.
Some hospitals have already been sent vaccine kits containing syringes, masks, and a diluting agent.
The logistics here are going to be complex, but we're really excited about it.
The vaccine is coming at a time when the U.S. is seeing a record number of daily deaths. More than 3,100 Americans died on Wednesday.
COVID-19 was the #1 cause of death in Idaho in November.
The first doses will go to healthcare workers and nursing home residents, with most of the general public not expected to get the shots until the spring.
The whole country's on fire. This crisis that we have right now, the vaccine is not going to save us.
Health workers are concerned the holiday season is just making matters worse.
It's very frustrating for us because we're trying to save people and take care of you.
Next week, the vaccine from Moderna is scheduled to go through the same approval process as the Pfizer-BioNTech vaccine. Bafta Imam, CBS News, Washington.
Vaccines from Johnson & Johnson, AstraZeneca, and Oxford University are also in the pipeline. Now it's time to turn our attention to weather. Ed joins us here on the set with that. It's Friday, and I don't need to be a weatherman to tell you this, but December's back in full force.
Yeah, that's right. It's cold out there this morning. You could even see a little bit of that haze with the first interstate ICAM. We have some pockets of fog across the area. Checking out 89% relative humidity at the airport at 20 degrees, considerably colder than our mornings have been. Even with just that little bit of a light wind, you're really going to feel it when you step out the door today. A big change. How about 11 right now in Miles City, 22 in Sheridan, 24 for you in Cody. And Livingston, you're right there at 25 degrees. Lighter winds across the region, only less than 10 miles an hour at most of the major reporting stations. But check out all the areas reporting fog here across the eastern plains this morning. Much of northern Wyoming, some of the visibility at times is down to about a quarter mile. So as you take a look across southern Montana and northern Wyoming, temperatures are in the teens and 20s. These areas of fog will cause some travel problems for you. And then we'll look for temperatures today likely staying in the low 30s. A little peak of sunshine perhaps around midday, but then the clouds move in, and we'll talk about the chance of snow coming up in a couple of minutes.
No way. We're going to take it a step at a time. Glad to see we're at least not hitting below zero, and the snow will come a little bit later. But
how about you with the glass half full?
Yeah, I'm trying to be positive. But I want to point out a stranger in the background. There he is, Wave Miller. He's not just a strange man sitting in the background. You'll get to know him a little later, but there he goes, Miller Robson. All right. Thank you, Ed. Thanks, Miller. I'll get back to news.
Thanks.
The U.S. Surgeon General is in Montana assessing the COVID-19 situation here. He says the state is moving in the right direction, but people need to keep up the good work to slow the spread. MTN's Jonathan Ambarian has more.
On Thursday, U.S. Surgeon General Jerome Adams joined Governor Steve Bullock for a news conference at the Montana State Capitol. Adams noted the country is currently going through some of its deadliest days for COVID-19, but he said he sees reason for optimism.
Montana has proven that these mitigation efforts work.
Adams said he's pleased to see that the rate of positive COVID tests in the state has gone down in recent weeks. He credited that to people taking steps like wearing masks, distancing, and keeping gatherings small.
We know more than we ever have before about this virus, and we know statistically that your efforts are working to slow the spread.
However, he remained concerned that many Montana hospitals remain close to capacity.
That means if you aren't scared of the virus, you still may not be able to get a hospital bed if you have a heart attack, if you're in labor, if you get into a car accident, because there may not be a bed available.
Adams acknowledged some people have questions about the health guidance they hear, since experts have changed their advice as they learn more about the virus. But he said data now shows clearly that masks work to limit the spread, and that the new vaccines will be safe and effective.
We will have more data on the safety of these vaccines at the point of administering them to people than we've had for any other vaccine in history.
Bullock said the state expects to get its first shipment of vaccines next week once they are federally approved. They hope to have 60,000 people receive a first dose by the end of the year, starting with healthcare workers. Adams noted tribal communities have been hit particularly hard by COVID. On Friday, he'll travel to the Fort Peck Reservation for the opening of a surge testing site. In Helena, Jonathan Amberian, MTN News.
Bullock said nearly 300 healthcare workers from outside Montana are now contracted to work in the state to help hospitals under strain. Here in Yellowstone County, restrictions will be extended through the end of January. Like the state, the rate of positive tests is down locally, but Health Officer John Felton says it's still dangerously high. He says he's hopeful the county avoided a major Thanksgiving surge in cases, but added there's not enough data yet to say for sure. St. Vincent Healthcare and Billings Clinic will receive just under 2,000 doses of the vaccine next week. Felton says their staff that have direct contact with COVID-19 patients will take all of those doses. Billings Logan International Airport is running at 60% of what it was last year, which is better than the nationwide average of 30%. That's just part of the information shared in a report by Big Sky Economic Development. Q2's David J. has more from some local business owners who got together to discuss the challenges of this unprecedented year.
The meeting started with how COVID-19 has affected businesses.
Party Time Plus, they have decided to close their doors. And I know that we all have just a moment of shock and sadness as we hear that news.
One of the owners of Soup and Such was in on the Zoom call. He talked about the challenges and changes for a restaurant, and especially for a buffet restaurant. Soup and Such has been able to stay open, but it's now needing more customers.
Summer was tough, and we were really hoping for a more robust recovery over the fall, but it just hasn't materialized right now. We're doing roughly right around 50 to 55% of our normal sales. It's not a sustainable model.
Others have also been able to stay open.
Even into late June, but especially going in the second half of the year here, we've seen sales come back to maybe not normal, what we'd want, but I'd say 90% of that.
Some from the medical profession talked about COVID's effect on patients and on hospitals as businesses.
I think we've learned some things through the pandemic that have catapulted us forward in ways that would have taken years to get there otherwise.
As somebody else pointed out, we're a regional medical center, and we have responsibility to a large area that we are taking care of.
The work that you're doing now and the learning you're doing now really has the opportunity to take our regional medical world-class healthcare status, frankly, to a whole nother level.
In Billings, David J., MTN News.
Thank you so much, David. And a quick note now for our viewers in Warden, water will be shut off starting at 9 o'clock this morning. The water district there is making an emergency repair to their main water line. Officials say water will be back on at 2 this afternoon. This will only affect Warden, not Ballantyne, but it does include about 200 customers and Huntley Project schools. In other news, the yearly defense budget recently passed the House, and the over $740 billion bill is now expected to be approved in the Senate as well. Montana Senator John Tester got a provision included in the legislation that expands coverage for veterans still feeling the effects of Agent Orange. 34,000 veterans across the country will now receive care for hyperthyroidism, Parkinson's, and bladder cancer associated with the poison. Tester says the bill helps America keep a promise to its veterans.
It's more than just health care. Anytime you get these conditions, it affects your quality of life and affects your ability to be all you can be. And so this also impacts disability pay too.
Senator Steve Daines also supported efforts to expand Agent Orange care for veterans and pushed for the inclusion of the amendment in October. Turning now to election news. As President-elect Joe Biden continues filling his cabinet, President Trump continues to dispute the results of the election. And now, as CBS's Bafta Yamam explains, a large group of the GOP is joining in on the latest effort to challenge the vote.
More than half of House Republicans, at least 106 to be exact, are now backing a lawsuit brought by Texas's Attorney General, aiming to overturn the election results in key states.
There's no way to know whether any of those 2.5 million ballots in Pennsylvania were legit. They could have all been legit.
The Department of Homeland Security and the Justice Department maintain there has been no evidence of widespread fraud or irregularities. Still, 17 Republican attorney generals also backed the suit against Georgia, Pennsylvania, Michigan, and Wisconsin. But not all Republicans support the challenge.
I do not understand the legal theory.
It's just simply this effort to subvert the vote of the people.
Officials from the states being sued say the lawsuit is an attempt to undermine democracy.
And I understand people are still emotionally raw. I still have family members who just want to, they cannot possibly imagine how Joe Biden has won the state of Georgia. He did.
Many legal experts say the suit is an extreme long shot.
It is achieving its aim just by the fact that we're having this conversation right now. And it is stunningly unlikely that it's going to get any traction at the U.S. Supreme Court.
Biden, meantime, continues to push ahead, assembling his senior leadership team. Yesterday, he named former Obama Chief of Staff Dennis McDonough as his pick for Secretary of Veterans Affairs, and Obama's National Security Advisor and UN Ambassador Susan Rice as Director of the Domestic Policy Council. Bafta Imam, CBS News, Washington.
And Montana's next governor is backing the Texas Attorney General. Representative Greg Gianforte was one of over 100 House Republicans who signed on to a friend of the court brief supporting the lawsuit. Back here in Montana, some tribal leaders say it's insulting and ridiculous to learn secondhand that a controversial new TV show wanted to use local landmarks without permission. MTN's Dennis Bragg has the story.
The ABC network show Big Sky is already under fire from tribal leaders across the country for its depiction of Montana and human trafficking. Many say it takes advantage of the serious issue of missing and murdered indigenous people for entertainment. The objections hit closer to home Wednesday when CSKT leaders received 2 emails, one from a producer and one from a Canadian actress, seeming to indicate the Flathead Reservation was going to be depicted in the show. Yet the tribe says no one ever applied for a permit or permission or indicated where the images were coming from.
We're just kind of ignored in the process, and it's just very insulting.
They look like tourist snapshots, maybe a YouTube video. I am not sure, but they seem to be sneaking around the edges. They did ask one movie person that we're familiar with for aerial footage, but I was kind of shocked that they're skulking around the corners trying to gather what they can find on the internet, it seems. I don't believe they've sent an actual film crew in our midst.
But beyond the logistics, Fine says it feels like another instance of tribal concerns being exploited, especially considering the tragedy and hurt behind the issue.
It's not just the tribal council, but, we have elders, we have cultural protocols in place, and they ignored all of that. They don't understand, again, that we're a sovereign nation, and I don't know how to fix that. I'm hoping this is a teaching moment.
In fact, Fine points to the documentary Somebody's Daughter released earlier this year as a means of countering the skewed perspective of Big Sky.
If they were to offer to show that documentary of real life cases, I would consider that. We do not want any affiliation with them. We do not want to be that token tribe or that basically a sellout.
In Missoula, Dennis Bragg, MTN News.
And Dennis tells us the tribe has contacted the producers and are waiting for an explanation. Before we take a break, there's plenty of sadness and frustration associated with the pandemic, but it's also highlighted amazing healthcare workers and resilient survivors, many right here in our community. This is COVID-19 survivor Terry Field becoming the first to take part in Billings Clinic's newest tradition. From now on, every time a COVID-19 patient is discharged from the hospital, they play a short segment of Beethoven's Ode to Joy from the overhead speakers. Terry spent 5 days in the hospital and is finally going home.
This gives lots of people hope. More people are recovering than not recovering, so there's a lot of hope there. This is a neat celebration of recovery, and I really feel blessed to be the first one to get the honor.